Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, living a longer and healthier life. And this evening, we're going to be talking a lot about women's health with a very experienced OBGYN, Dr. Alan Patterson. You may remember him. He's been on the show, my show, 3 other times in the last 3 years, so I'm really glad to have him back this evening. Dr. Patterson has offices in Boca Raton and Coral Springs, and I'll give out the info, but without further ado, I want to welcome Dr. Patterson back to the show. How are you this evening?
I'm great. It's a pleasure to be here. Thanks for inviting me again.
Thank you, and thank you for joining us on this adventure of health, because we're always talking different topics. I've had a lot of internists on this program lately, internal medicine, and we talk a lot about bacteria. Of course, they're studying bacteria. And I know that's one of the topics that always comes up when you're having an internist on. I know you're a different field. You're an OBGYN, but what is one of the most common things you're seeing in the summertime in your office?
Well, year-round, but more common in the summertime, we see a lot of women come in with yeast infections and bacterial vaginosis. A yeast is caused by 4 different strains of Candida albicans, and people can get yeast infections from heat, humidity, from being on antibiotics too long. And bacterial vaginosis is usually caused by 2 or 3 different strains of bacteria, and a lot of things can lead to bacterial vaginosis, change in hormones, sometimes antibiotics, stress. And one of the best things you can do is to try to get on a good probiotic, because it's quite common down here to have the infections. And if you take a good probiotic every day, that will make your vagina grow more normal lactobacillus to help prevent both yeast and bacteria infections. So if you can prevent it, it's better. And once you get the infection, the probiotic isn't going to make it go away. You need some type of treatment. And there's various treatments depending on if you have a yeast infection, bacterial vaginosis, or sometimes you can have a STD, a sexually transmitted disease, with either one of those, or sometimes you can have them all together. So you have to have proper diagnosis and treatment, and sometimes one can mimic the other one. So you have to see somebody that knows what they're doing. And a yeast infection, most people can usually tell if they've had one. But the other ones, you shouldn't try to self-diagnose, because you could end up missing something or letting something linger that turns into something worse. So you should see a good board-certified GYN like myself for proper diagnosis and treatment.
Now, when you mentioned probiotic, is that something they can talk to you at your office about, or is that something that could be
bought? Probiotic can be bought at any drugstore or online. I mean, I have a couple companies that specialize in female products that I recommend, that I can give them the link through their cell phone, and I think those are better ones. But different ones work for different people. Some people need a stronger one, but they can get very expensive. So the ones I recommend are good ones, but they're not overly expensive, and that's something that you just have to get in the habit of taking every day. I mean, young women should be on probiotic and a multivitamin every day, because a multivitamin is good for your body, helps prevent disease, and makes up for a lack of nutrients in your diet. And the probiotic will keep the vaginal flora healthy and help prevent yeast and bacterial vaginosis.
Now, you have offices in Boca Raton and Coral Springs. What age range of patients do you treat?
Basically, depending on the situation, probably 15, 16 up until 100 if, somebody needs treatment like that. Obviously, I also deliver babies, so I see people in that age range, but I also see perimenopausal and menopausal women, so I see the whole age range of patients, as most gynecologists usually do. There are some gynecologists just specialize in pediatrics, which those are good because they have special problems. And if I have somebody, sometimes I have to refer somebody to a pediatric gynecologist or other subspecialists, but we see the whole age range of female patients.
Now, and we're going to talk a lot about, delivery and, pregnancy as well, and also get into a little bit about premenopause and menopause. But before we go to those topics, one of the fastest growing age ranges in the U.S. is the baby boomers, if not the top fastest growing age range in the U.S. And I'm reading a lot about osteoporosis. Now, it's a condition that I was something that was interesting to find out that an OBGYN can help out with it in terms of the bone density screening that is done, I guess on normal appointments or that maybe a yearly checkup.
Right. I mean, bone density is a screening test. I happen to have a bone density machine in one of my offices. They're quite expensive. A lot of OBGYNs don't have that, but I share this machine with other doctors, so we're able to offer screening in our office instead of sending the patient to an outside facility. It makes it more convenient for the patient. We have a brand new machine we just bought this year, so it's state-of-the-art, and we know the results right away because bone density screening is important. You can do it. Usually insurances pay for it every 2 years. Different insurances have different age ranges that they started at, but it's an important test because you can start to lose mineralization of the bone without having any symptoms, and the earlier you catch it, the easier it is to treat. Once it gets bad, it can lead to fractures, and fractures can lead to all kinds of problems, and you have to take stronger medicines that could possibly have more side effects. So that's something, if you're at risk for, you definitely want to do it. It's a painless test. It's easy. Insurance should cover it, and it can be very beneficial because I'm into prevention rather than treatment. If we can prevent first, then we don't have to treat it. A lot of times we have to treat it, and I'm skilled to treat anything I need to do. But if I can prevent something, just like vaginal infections, yeast infections, you want to prevent somebody from getting bad osteoporosis, which could lead to hip fractures with all the complications that can have, or spinal fractures. That's why you see a lot of older ladies with that hump in their back, because they have spinal compression fractures that were never diagnosed and treated, and it makes them have a humpback, which is very sad because in a lot of people that could have been prevented.
And how does that bone density testing work with the machine? How does it
It's just like a scan. It's a scan that you that you lay down on, and it scans the bones. It's very non-invasive and easy. It doesn't hurt, and it gives you a measurement of how much mineralization is in your bone. So it's an easy test to do. Shouldn't have any complications from doing it. You can do an X-ray of the spine with it. You don't have to, and that's the options that you have.
So right there, it's done right there in the office.
It's done right there in the office. You go over the results right away, and then I can present the patient with their treatment options, because depending on how bad it is, sometimes you can try some herbal things if something's very mild, but then you can move into different prescription things, and depending on what their situation is, what other meds they're on, how bad their bone density is, and there's different options, and there's different things that work better for different people, but at least they know where they're at so they can do the appropriate thing.
We're here with Dr. Alan Patterson. He's an OBGYN and an infertility doctor, right here with an office in Boca Raton at 660 Glades Road, Suite 340. The number there is 561-417-4000. You also have a office in Coral Springs, 7451 Wiles Road, Suite 205.
Correct.
And that's the number's 954-755-9311, and we'll give out that info again. on the program. Oh, let me give out your website too. There, that's where I got all this information. OBGYNPatterson.com. It's OBGYNPatterson.com. Ton of info on there, Dr. Patterson, and all your areas of interest are easily labeled. There's insurances you accept, just a ton of info there. So that's great news for anybody looking to learn a little bit more about you and your practice. Now, how many years have you been in practice?
I finished my residency in 1983, so I've been in practice since then. I practiced in Indiana from 1983 to 1991. I moved down here in 91. I worked for somebody for a year, and then I opened up my own office in 1992. So I've had my own office, 2 offices since 1992.
Wow. You've been in South Florida a good while then.
Long time. Long time.
And where did you go to? I never got to ask you this because we're always get going. Where did you go to medical school?
Oh, medical school. I went to Indiana University because that's where I'm from. I did my residency at a very good private hospital in the city, St. Vincent's Hospital and Healthcare Center. And then I practiced in Indianapolis from 83 to 91, and I moved down here in 91.
Okay, and St. Vincent's is in Indianapolis.
Correct. It's on the north side of Indianapolis. Very good institution.
That's great to know. I always wanted to ask you that, and we never got to it the last few times.
No problem.
We got that out of the way. Like I said before, I want to ask you a little bit about premenopause and menopause, because I saw on your website that in some cases hormone therapies are needed. So what should today's woman know about premenopause and menopause, and when is hormone therapies an option?
Right. Well, premenopause is, the definition of menopause is if you still have your uterus, is no periods for 1 year, but it's actually when the ovaries stop working, because the ovaries produce estrogen and progesterone, and there's other hormones that your body makes, and the ovaries produce a little bit of testosterone and that sort of thing. So people in premenopause, before they actually go through menopause, can start to have symptoms of decreased hormone, which are hot flashes where they feel hot when everybody else is comfortable. They can be worse at nighttime, so they can lead to lack of sleep. You can have decreased sex drive, a loss of interest in other things, and that can get worse during menopause. Everybody's different. Some people don't have many hot flashes. Some people can have terrible hot flashes. So depending on what the person and their specific symptoms, a lot of times you can try some herbal therapy to try to be natural to start out with. And there are some very good herbal products that I offer through a couple companies that specialize in women's health care. One of them, Shift MD, but you have to get it through a doctor's office, that works very well to stop menopausal symptoms. But a lot of people need hormones, and there's various forms and ways to do hormones. And there's all different kinds of hormones depending on the person, their situation, their insurance situation. What works for one person may not work for another person. One person may just need estrogen and progesterone. Another person may need estrogen, progesterone, testosterone, DHEAS, other hormones. Each person's different. So based on their symptoms, and you can do blood testing to see what their levels are, and blood testing is much more accurate than saliva testing or anything else. You can see what the person needs, and then you can present those options to the patient, and we make the decision together. And then sometimes you have to tweak it or change hormones, which is fine, because you want the person to be able to have good quality of life without having side effects.
And how are the hormones taken? Is it something orally or is it injection?
Well, there's all different kinds. You can do oral hormones, you can do injections, you can do pellets, you can do creams, you can do sprays. So there's many different hormones, and also, there's hormones that go in the vagina for vaginal dryness and atrophy, which women can get in the perimenopausal and menopausal period, and that can be very uncomfortable because it can lead to pain with intercourse, burning with urination, irritation, and there's specific hormones that go in the vagina, and there's some newer ones that just came out that work very well.
Now we're here with Dr. Alan Patterson. A lot of different options for women's care available today. And we're going to take a quick break, and on the other side, talk to Dr. Patterson a little bit about the other side of his practice is delivering babies and pregnancy on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back with Dr. Alan Patterson. He's an OBGYN and infertility doctor right here in Boca Raton and Coral Springs as well, OBGYNPatterson.com. Before the break, I was talking a little bit about the other side of your practice is you're a delivery and pregnancy specialist. Last time we had you on, I think you had delivered 5,600 babies, but I know that number's probably close to 5,700 and beyond. So that's still a big part of your practice?
Yes, I still do have active obstetrics practice. I deliver at two hospitals, Boca Raton Regional Hospital and West Boca Medical Center. And I do low risk, high risk pregnancy, and I'm still, very much doing obstetrics.
I know it's probably we could spend a whole show or the whole day probably on what a high risk versus low risk pregnancy is, but kind of give us a little breakdown of what makes a pregnancy high risk, starting with high risk.
Sure. I mean, there can be various factors. Somebody can be a high risk if they have some type of chronic medical condition, like lupus or chronic hypertension. That can get exacerbated during pregnancy, and you need to manage that special. Somebody can develop problems during pregnancy like premature labor, gestational diabetes, high blood pressure, different things like that. So depending on what the situation is, we manage those pregnancies differently. And I work very closely with a good perinatologist, my friend Dr. Thomas Lowe, and he helps me manage my high-risk pregnancies. I do the delivery, but he helps with the management because he's actually a perinatologist, so he's skilled in taking care of high-risk situations. And a lot of times I go with his recommendations, and we work together to give the patient the best care they can get so they have two brains managing them instead of just one. And I trust his judgment, and it works out very well for me and my patients.
Now, the other side of that is there's low-risk pregnancies as well. It seems like there's always something to watch for in a pregnancy.
Right. I mean, somebody considered low risk. A low risk can become a high risk at any time. You can't predict the future. A low risk is somebody that doesn't have any medical problems, no other issues, that their pregnancies progresses normally, their lab works normal, they don't get gestational diabetes, high blood pressure. But somebody that's low risk could become high risk during labor or postpartum. So I hope for the best, but I'm always prepared for the worst. That's why in the United States you should deliver at a hospital or a licensed birthing center, because if you take a chance and deliver at home, you may or may not have a good outcome. You can be totally normal and develop a problem in labor with the delivery or afterwards, that if you were in a hospital that could be taken care of, where in a home it can be a disaster. If I could predict the future, I would tell everybody to go deliver at home, but you can't predict the future, so you can be very low risk and develop a complication. That's why you go to a good board-certified doctor like myself and deliver at a hospital or a birthing facility that has all the drugs, all the expertise, all the other people available if you develop a problem. And hopefully you won't, but if you do, it can be the difference between life and death being at home or being in a hospital. So I can't stress enough, in this country, you should deliver in a hospital or at a licensed birthing center where they have the facilities and the expertise to take care of you if you would develop a problem.
Now, I know part of the process with the pregnancy care provided before the baby is born has a lot to do with different stages of the pregnancy. Ultrasounds. Talk a little bit about how ultrasounds have changed. It seems like maybe doctors are using them more today than ever.
Well, ultrasounds are much better than they used to be.
That may be it. The imaging, right?
Yeah, the imaging is much better than it used to be. I mean, when I first started training, I hate to say it because I'm kind of older, that ultrasounds were not that good. And I mean, one time when I was I think second-year resident, one of the staff persons had somebody in labor, and that pregnancy was actually outside the uterus, which is very rare. The ultrasound missed it, which was not a good situation. That would never happen now. But you'd use ultrasound to help manage the patient. I always like to get an early ultrasound between like 6.5 and 9 weeks to make sure that the pregnancy is viable. You can be pregnant and have normal blood work, but you want to make sure you have a baby with a heartbeat. Then the next ultrasound we get is around 11.5 to 13.5 weeks, and that's an ultrasound to check the baby's neck to make sure there's no spina bifida. Then the next ultrasound is usually around 20 weeks, and that's called the fetal anatomy scan that I send my patients to Dr. Lowe for, and he checks about 60 things on the baby to make sure everything looks normal, and he also measures the length of the cervix, because if somebody has a short cervix, they could deliver the baby prematurely, and sometimes you can have a short cervix and have no symptoms or no history of it. So that's an important scan. And then I usually get a scan toward the end between 34 and 36 weeks, so I know how big the baby is, make sure the baby's head first, make sure the fluid's okay, make sure the placenta's okay. So my average patient is going to get 4 ultrasounds, and in this community, that's usually the standard of care. Some people don't get that ultrasound at the end, which I think is ridiculous, because the baby could be bigger or smaller than you think. There could be a problem with the placenta or the fluid, and you're just guessing. I don't like to guess. I like to know as much information as possible, because that last ultrasound can help determine your management and can be the difference between a good outcome and a bad outcome, or laboring, or maybe if you have a 10-pound baby, you know it's too big to labor, so you don't want to labor. So that ultrasound is very important. So ultrasound is an important part of obstetrical care. And if the doctors aren't doing those ultrasounds, in my opinion, they're not giving you the care that you deserve.
And we're here with Dr. Alan Patterson. He's an OBGYN right here in Boca Raton, 660 Glades Road, Suite 340. And then also in Coral Springs, right around the corner there, 7451 Wiles Road, Suite 205 in Coral Springs. The number in Boca is 561-417-4000, and in Coral Springs, 954-755-9311. Now, you also help with fertility treatments out of your practices?
Well, I do basic infertility work.
Sometimes infertility.
There are certain things that a woman can do if she's trying to get pregnant to make sure that those are okay. I mean, one thing, if somebody's trying to get pregnant, the definition of infertility is if you've been trying for 12 months and you're unable to get pregnant. But a younger woman shouldn't have to try that long. I give them the time frame of 6 months, because you want to make sure everything's okay, or you want to start moving toward a workup. The 2 most common causes of infertility are lack of ovulation, meaning the lady doesn't release an egg each cycle. If you don't release an egg from the ovary, you can't get pregnant, or there's something wrong with the semen. So those are easy tests that we can do in the office, and we do blood work, ultrasound, and other tests. But if it turns out that it's not something easy, we have very many good board-certified reproductive endocrinologists in this community, and I turn it over to them because their expertise is better than mine. I know what I'm good at treating, but I'm not going to treat something that I don't feel I'm good at if there's somebody better to treat it. So that's in the best interest of the patient. Sometimes a regular OBGYN will try to treat too long, or will treat something that's not working too long, instead of referring them to the reproductive endocrinologist, which is the proper thing to do, especially in this community.
That's great info, Dr. Patterson. Unfortunately, we have less than 2 minutes. I just want to ask you, because everyone's talking about the HPV vaccine, in a minute or less, if you could just kind of give your...
I mean, the HPV vaccine, assuming you don't have any strange reaction to it, which is very uncommon, is a very good thing, because it can prevent a woman or a young man from getting HPV, because in the female, HPV can lead to precancer or cancer of the cervix, and it leads to a lot of testing and a lot of treatment. So if you can, once again, we're to prevention. Prevention is always better than treatment. So it's a good thing if you can get the vaccine because it will prevent HPV, which is spread by sexual intercourse, and it can prevent precancer or cancer of the cervix.
Thank you for explaining that. Again, Dr. Alan Patterson, great OBGYN in our community. Check him out. He's got a lot of different options. We talk a lot about prevention. That is key. We talk a lot about that the prevention on this show with any type of medical specialty we have, which is great. So, again, OBGYNPatterson.com. His Boca Raton office, 561-417-4000. There's a ton of information on his website, OBGYNPatterson.com. Thank you, Dr. Patterson, again.
Thank you. My pleasure.
It's hard to believe. Yeah, we need an hour because we just ran through everything in 30 minutes. But thank you until we have you on next time.
Thank you so much. Enjoyed being here.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding